Today we talk about introduction to systematic review and meta-analysis. Me, I'm Raghad Al-Hajjaji, family medicine consultant and clinical researcher. Okay, as a medical student, when you want to start writing a proposal, protocol, doing a research, building a hypothesis and strategy, methodology, you always be distracted and you don't know from where you can start it. Who will guide you? So today, step by step, we will talk tips and the most important to be an expert in systematic and meta-analysis. We talk today just about introduction, primary and secondary research, steps and the characteristic of good research question. And next couple of weeks we continue this is course until you become expert in systematic review and meta-analysis. After finishing the protocol or proposal and finalized your manuscript, you thought this is the journey of publication. Always we thought about it like this, but actually it's not like this. There is many struggles. You will find it in the publication, rejection, no reason for rejection, and jump from journal to another until acceptance. It is a long journey, but we simplified it. We talk about the tips also for publication, the characteristics of medical writing and expert writing, and how to get accepted in a strong journal. Types of medical research: primary research, secondary research. Primary research, that's mean you have a raw data and you build your own research question from this is raw data, and you are the first to deal with this data. Mostly it is original data, and many types of primary research include clinical trials, case control, cohort, and case report. While the secondary research, we have already published research paper. We have a research paper, published research paper, and we draw conclusion from this is research paper, chapter of box, and so on. Example, we have a narrative review, another name of literature review, scoping review, systematic review, and systematic review plus meta-analysis. Study design. We have two types actually of study design: experimental and observational. And the big crucial question to different between experimental and observational, this question: did you as the investigator, did the investigator assign the investigation the exposure and the outcome or no? Did the investigator assign the exposure? Did the investigator decide who took the treatment and who not took the treatment? This is the experimental. But if you are already working in hospital and you have follow up with the patient who already took some certain of medication, other patient, for example DM patient prefer to take just metformin, and another after the discussing the treatment plan with the patient, other just want to do lifestyle modification and refuse for treatment, oral therapy or even injectable therapy. So, and you follow this patient until the outcome decrease in the hemoglobin A1C or complication or so on. This is the observational study. We have the patient with the medication already. We didn't assign and we didn't decide who took the medication and who not took the medication. So in the experimental, many subtypes. The main two subtypes: randomized controlled trial, non-randomized controlled trial. While the observational study, we have analytical and descriptive studies. So the main difference: the experimental assign as investigator, principal investigator, we assign the patient to take the medication or not taking the medication, or our intervention, assigned to the intervention. The observation study, we have analytical and descriptive. The analytical cohort case control cross-sectional cohort, from the cohort, from the name of cohort, so we have a group of patients, follow them with time from the exposure to the outcome. Even we follow them prospectively or retrospectively. The case control, we took the patient from the outcome. The patient already had the outcome and we took them from the outcome, then we go backward to the exposure. And cross-sectional, analytical cross-sectional. While we talk about descriptive, we have a rare finding. It's a new finding. Here it's case report. Me as an investigator or as a physician, I wrote about this is what I saw. For example, a new outcome from the medication, a new outcome from new sign and symptoms didn't fit to any disease. So I write about it a case report. While case series, if we have a many case report, 10 or more, and collect them together, we here talk about case series. Cross-sectional descriptive snapshot, we talk the outcome and the exposure at the same point of time, and we do description about them. The primary research. So the research primarily, that's me as an author. I'm the source of the data. I took the raw data and I formulate the research reports, analyze and interpret the resource. So primary, it's original, first hand, the author, source generator of the research data you are using. While the secondary he talk about the published already research paper or book or any about the certain topic, and we collect this is together. So the secondary research doesn't present a new experimental result, a summary of previously published research topic, and it is the research article that may analyze and discuss the method and conclude in previously published studies. Why we need systematic review and meta-analysis? Actually, it is the top of pyramid in the strong evidence after the clinical guidelines. We can build a clinical judgment, strong applicability in the clinic if do it by good way, and we following the guidelines, and the result it is statistically significant without heterogeneity or low heterogeneity. Why systematic review? We have actually now a large amount of medical literature, and there is a lot of papers published day by day, especially with the AI now modules and AI driven solution in medical research. And the researcher, me and you as a physician, we can't compass this is the huge number of data. So we need summary and strong summary as executive summary. When we talk about the administrative work, we have executive summary. I think the systematic review meta-analysis, it is a strong summary, give it to the clinician and physician to build their guidelines, their clinical decision on the clinics. Systematic review minimize the bias if there is a bias in the literature or scoping review or traditional review, but systematic review do systematically and in fit small guidelines and steps. This is lead to minimum bias in the methodology and in the outcome. The volume of published material, as we mentioned, makes it empirical for individual clinician to remain up to date in variety of common conditions. For that, this is the urgently need for systematic review. Save the time of clinicians, furnish the extent overview of the subject, explain the current state of knowledge, update of our knowledge, pinpoint deficiencies in prior research for prospective investigation, address conflicting finding among various studies, systematic review, and the source of high-grade evidence actually. Types of article, as we mentioned: narrative review, which is other name of literature review; scoping review. We have the systematic review plus the meta-analysis. Here the literature review, as you see, it is a huge and very wide. Systematic review narrower, meta-analysis even narrower. Narrative review, it is a comprehensive label involved a various review styles that extend beyond more subject viewpoint or commentary. Within narrative review, scholars have a freedom to dive into through explanation, analysis of previously published material pertaining to selected subject. For example, I want to talk about hypothyroidism. I would take from the previous literature the introduction, the definition, and sign and symptom, also the differential diagnosis, the confirming diagnosis modalities, and the treatment options. So this is actually simple narrative review. It is resemble a chapter in book. When we talk about narrative review, we talk actually about chapter in book. We don't have any BICO, we don't have any methodological strategy here. While scoping review, it is the area between narrative review and systematic review. It is in the middle actually. Takes some wide variety from the narrative review, but there is some sort of BICO in the scoping review. So in my opinion, it's a steps before systematic review. Sometimes we cannot judge if this topic fit to be as a systematic review or not. So we conduct exploratory searching. This will be as a scoping review. So it is type of literature review that's aimed to provide an overview or mapping of the existing literature in particular topic. And we need actually to know the gaps in the literature. By systematic review we can identify it. This is type of research. It is very important, and it is crucial when we building a policy and procedure. When we have a new topic in the era of medicine, we find this scoping review. It is very useful. So high evidence, actually only the systematic review. While we talk about establishing the methodology, yes, we have methodology in systematic review and scoping review. Details of synthesis research question only for systematic review. Broad topic overview, here we have it with the scoping review and with the narrative review. Studies that aim to map the literature on particular topic, here we talk about scoping review. Provide opportunity to identify the key concept also in the scoping review. Identify gaps in the literature, mostly exploratory and more complex research question. We use it for policymaker, for researcher to informed, and sometimes for practice. Systematic review. The key point of strong high evidence research: systematic review. Secondary research, review that conduct according clear stated scientific research method and designed to minimize the bias. This is very important. We have a lot of bias in narrative and traditional review. Minimize it by systematic review. As you see the study, and we have steps. It is very clear, it is very crucial, and following guidelines, then the systematic review done, and we have a very strong outcome. We can apply it in the practice. Actually, most of the systematic review, if we do it by good clinical, following the clinical guidelines and do all steps, and we critically appraise, this is a manuscript published article, we can apply it in the clinical practice. Meta-analysis. Actually, meta-analysis is a draw conclusion. Some types of systematic review, we apply meta-analysis if there is data in the same paper and all the data, this is applicable for data extraction, and we can talk this data extraction formulated into the forest plot, and this is will be a meta-analysis. At least we need 3 research paper, and never this is a topic done before during the last 2 years. Meta-analysis statistical technique for combining the result of independent but similar study to obtain overall estimate of treatment effect. The difficulties with data extraction is that studies often use different outcome metrics, which make combining of the data awkward. The data should be converted in uniform metric for polling. The difficult actually steps in the meta-analysis, the data extraction. But if the data extraction do it by the good manner, here we can say yes, it is a strong meta-analysis, low heterogeneity, and do it by good manner. So why we need the meta-analysis? Analytical step for systematic review is combine and integrate the result of the included study. One do the research paper in America, the same topic done in China, and same topic in the Middle East. We can collect this 3 RCT and put it in one forest plot. It will be very stronger when I use just one study result. It's give one result that represent the overall result of all studies. It's give power of statistical test, power source of clinical evidence, and done by special software. There is many actually software, but mostly we use the Riefman software for analysis. This is very nice meta-analysis done by Cochrane database, the first actually data meta-analysis done. This is about the use of lung maturity in premature baby. If we can use the dexamethasone for premature baby to improve the lung maturity, and the outcome will be decrease the mortality. Some babies need to deliver prematurely for some outcomes, some certain red flags, and according to the doctor treat those patients. So first study show it is significant, not cross the line, so it is significant, line of no effect. Second study give the conclusion not significant. The third not significant, fourth not significant, fifth not significant, sixth significant, seventh not significant. But we talk about the bold study. This is the bold study actually about the overall bold from this study give us significant, and this is the result of this is the Cochrane meta-analysis save a lot of lives, of babies' lives by taking this medication, and this is the power it can applicable in the clinic. 3 skills need for any researcher: data collection. You need to know how to do a data collection. This is mostly in the primary research. You need to know the use of biostatistics or analysis. There's a lot of software, SPSS, Stata, Genovi, and so on, but you should at least know how to deal with one of this program. Medical writing, it's very important skill to know how to write medical paper. We have many part, and each part it's like a puzzle. You know when you use the introduction, certain words, certain manner, certain following in the sentences, and after that the methodology. We need to include a most important part in the methodology and write it very clear. very well, and this is the methodology. It's always decide if this paper is strong or weak. After that, the results and the discussion always we have some sort of comparison between our result and a previous result. So, characteristic of the good clinical research question. Actually, when we talk about the characteristic of clinical research question, we need the question to be clear, focused, concise, complex, arguable. Focused, the most important for me, focused and not complex. Why? Because if it's do it many time and it's very easy, no need to do research about this. Okay, thank you for your time, and next time we talk about the steps of systematic review and meta-analysis. Each step it will be a lecture, and we will talk about these steps in details in the future couple of weeks. Many thanks for your time.